I can hear the demons call when they do what they do. And now I feel like taking off, find a place with a view. The pain is never gonna stop if it's controlling you. I know that time can heal it all, I just gotta get through. I just gotta get through, I just gotta get through. Cause I feel like taking off, find a place with a view. The pain is never gonna stop if it's controlling you. I know that time can heal it all, I just gotta get through. Sometimes I feel like all is lost, but I know it's not true. I wanna put up all my walls cause I'm not in the mood, but then I cut myself off from the rest of the room. I know that time can heal it all if you're patient and soon. It can all be worth it, all the searching. Pain is never really permanent, but damn it hurts, man. I could feel all of the turbulence and it's concerning. I've been searching for a purpose, I hope it's worth it. This society is really trying me. Ain't no hide and seek, I hide to be far from anxiety. I need my space, I need my pride.
Hey everyone, welcome back to my channel, and today I'm just gonna do a day in the life of working in an alcohol and drug recovery center. So nothing really special today. I'm just gonna do some admin work, prescribe medications, tidy up my notes, and then later on we're gonna visit a client. So my clients today are mainly cannabis treatment. So I'm just gonna assist them and prescribe them with medications for them not to suffer severe withdrawal symptoms from withdrawing from marijuana. So we're going to talk about cannabis withdrawal treatment. One of the common abused substance or drug out in the community is marijuana. So we treat marijuana withdrawal here in our recovery center. So I prescribe medications for them not to suffer severe withdrawal symptoms. They will suffer mild withdrawal symptoms, that is expected, but with the medications that I'm going to prescribe to assist them in withdrawal treatment successfully, for them not to have severe withdrawal symptoms, then I'm going to do that today. So this particular client is a new mother. She has a 7-month-old daughter. She's had treatment in the past. She was admitted in a detox unit and she was there for 10 days and she was treated for cannabis withdrawal. But the medication that she was taking there was a little bit different, because when she was withdrawing from marijuana, it has affected her behavior. I think she got so aggressive and agitated. So simple benzodiazepine such as diazepam won't manage both the withdrawal symptoms and the behavior concerns, the behavior issues. So she was given Seroquel to manage the behavioral symptoms as well, and then she was given PRN, or whenever needed, diazepam or Valium dosages. Okay, but here we're gonna start a home-based treatment. Okay, it will run for 8 to 10 days depending on how she will react to the treatment. We will be reviewing that on an ongoing basis. So basically we are supporting clients who are addicted to cannabis. Cannabis is the medical term for marijuana. So she reckons that this is the best time to undergo a treatment again now that she has a daughter. She wants her daughter to look up to her and be a good role model. Okay, it's not good for small kids to see their parents abuse drugs, to see their parents not being productive. Okay, so this is a great way to turn things around. Okay, I have complimented her. I told her that she's actually very brave. She's very committed this time to turn things around for her daughter. So she will be on a probably 7 to 10 days of treatment with diazepam, and I'm going to follow up with her on an ongoing basis just to monitor her progress, or if there's anything else that needed to be done just to support symptom prevention. So how do you know whether a person is addicted to cannabis or any substance? First is if they're craving for it. Okay. Second, these are the common ones. Second is if the amount of the drug use is increasing. So what are the common cannabis withdrawal symptoms? It could be anxiety, it could be sleep disturbance, you're not able to fall asleep at night. It could be irritability, gastrointestinal symptoms such as diarrhea. It could be tremors, shaking of the hands, cravings, huge cravings. Those are the common withdrawal symptoms. And cannabis is one of those substances that are commonly abused by people. Okay, but in some other countries, including here in Australia, cannabis is slowly becoming a part of a medical treatment. Specifically here in Melbourne, where I am based, there's a lot of medicinal cannabis popping up. Okay, only because it's been legalized. Okay, about 4 or 5 years ago, it's been legalized to access marijuana or medicinal cannabis for certain types of medical conditions. Recently, I have referred one of my clients to a medicinal cannabis for her sleeping disorder. She has tried other treatments. She's seen a specialist to sort out her sleeping disorder, but nothing works. And when I have referred her to a medicinal cannabis clinic and she's tried a few doses of cannabis, it was like a miracle for her. She said that it worked. It has helped her sleep. And this particular client that I'm going to start the treatment now, I have discussed briefly about accessing medicinal cannabis. So she is accessing marijuana or cannabis off the street. Okay, illegal. But I said, if you are concerned about your mood, about your mental health, and you think that cannabis is helping you stabilize your mood, then we can discuss about medicinal cannabis later on after she finished her cannabis withdrawal treatment. So it's an option for you out there, guys. Don't be afraid. If medicinal cannabis is legal at your place, do some research, talk to your doctor. Okay, it will help. It's one of those alternative medicine that we have out in the community. Sometimes we need to think outside the box. If the conventional treatments, the expected medications for certain condition won't help, and you've tried a lot of medications and they're not helping at all, then you need to be open-minded. Okay, you need to be open-minded. The world is evolving, science and technology is evolving, medicine is evolving, and where we have come to this stage wherein alternative medicines can help. Okay, and one of them is medicinal cannabis. You need to talk to your doctor. You need to do your own research whether it's for you. But like what I said, you need to have an open mind, because you never know. This might work for you. So what I'm going to do now is I'm going to write some prescriptions, send them to the pharmacy, and I'll call a few pharmacists today. And after that, I'm just going to tidy up my notes and then go home. What I'm going to do is I'm going to show you one of our typical consulting rooms. I'm actually in one of them. So I'm just going to quickly do a 360 degrees to show you our typical consultation room. So this is for our clients, for our patients. So if they have their support system or family or friends, then they can sit there to listen as well. And then this is for our clients, for our patients, and this is where our clinician or myself or our counselor will sit, and they can discuss a few things about the treatment. Okay, and these are the computer that they can use to write notes or to refer some resources online, then they can show it to the client. Obviously we get a wall clock because we are so time conscious here, and we've got some telephone to call people who are involved in the treatment. We've got whiteboard. We use this whiteboard especially if we want to explain something to our clients in a deeper way. Some of the clients are really good in following our discussion if we write something on the board, and they can retain the learnings that they have. Some of them are very visual, so we write some things on the board so that they can remember what we have discussed, and just some of the reading materials here. And then we've got some paintings like this as well. Clinic rooms are used for consultations and help them understand things. Most of the time these rooms are used for counseling, so having this kind of painting will help them calm down, and will make them comfortable discussing a few things about their treatments. So that's it. This is just one of the typical rooms that we have. This is actually one of the smaller rooms, but some of our rooms down there are a little bit bigger. So I'm just gonna write some prescriptions. I'm just gonna call some pharmacies, and then tidy up my notes, finish my notes, and then I'll finish for the day.
I can feel the blood creeping up from the heathens. Got will, got fight, got pride, got reason. If they wanna go eat, then you know I'm gon' feed them. If you're coming for me, hope you're ready for a demon. I got eyes in the back of my head, I'm seeing. Take me for granted and you know I'm leaving.